So this is pregnancy. Pregnancy, by definition, is just carrying a fetus. There's an embryo or a fetus inside the uterus. Um, it in itself is not a disorder, but there are disorders of pregnancy. There's disorders that go along with this altered physiological state. So, a couple of physiological changes and their implications for body workers for massage is loose ligaments. One of the things that happens is hormones are released that causes ligaments all over the body to loosen. To And the idea is that it makes the birth canal larger and easier to deliver the baby. It starts early in the pregnancy because it takes some time to loosen up, and it takes some time post pregnancy to retighten back up. So, because the ligaments are loose, the joints are relatively unstable, and that has to be addressed. Now, as you remember from clinical anatomy, unstable joints are stabilized, or joints in general are stabilized three ways: by the shape of the joint, and by the ligaments that cross the joints, and by the muscles that cross the joints. As you lose stability in the ligaments, you try and make up for it using muscle tone, and so it leads to hypertonic muscles when you have loose ligaments. There's a fatigue factor because carrying extra weight, and uh, and the hormonal changes. Um, Something that's not talked about that much is proprioception starts to change. There's rapid changes in size and shape, in weight, and so what ends up happening is the woman doesn't know where she is in space. What her proprioceptors are telling her and what is reality are two slightly different things. So it leads to clumsiness, tripping injuries, falling, that kind of thing. Um, the same thing happens during growth spurts around puberty in kids as well, for the same reasons. There are all kinds of complications that can happen during pregnancy, and by no means is this the complete list, but there's four things that we really have to be aware of. One of them is deep vein thrombosis, and it's got it's got to do with it's post partum, so it's post labor. Blood is a little bit thinned, or and or a little stagnant. The heart is used to pumping through the placenta. Now the placenta is not there, so the possibility of uh, deep vein thrombosis is actually greater, uh, and it can lead to pulmonary embolism. Remember that all deep vein clots end up in the lungs if they embolize. Um, that's a that's a big risk, and it's something that we have to be very aware of because massage can dislodge that deep vein clot, and so what would just be a clot and say some leg pain can actually turn into pulmonary embolism. Be quite dangerous. Um, Gestational diabetes is a complication. It happens to a lot of people. I'm going to actually look at that a little bit later. I'm going to do a separate um, slideshow on that from something from a website. But it really there's risks to babies and to mothers with the gestational diabetes, and it's basically high blood sugar because of being pregnant. Um, One of the things that we'll see or that happens is that um, the placenta releases a lot of hormones. The placenta is a very strong endocrine organ that affects the mother greatly, and a lot of those hormones work against insulin, uh, and so sugar levels go up. when the sugar levels in the mother go up, that means sugar levels for the baby go up, which means that the baby grows more. So they actually get to be quite large, high birth weight. It's called macrosomia, big body. Um, a lot of babies, when mother has gestational diabetes, are born prematurely, and the lungs are the last thing to develop. So when the lungs aren't fully developed, it ends up with respiratory distress. Uh, the baby is used to having high blood sugars, and so pumps out a lot of insulin to counteract the high blood sugars that it's getting through the placenta. And then after the baby's born, there's no more high sugars. And so what ends up happening, they have an overproduction of insulin for their size and weight, and they end up in a hypoglycemic place. Um, they can also become obese later in life because of this extra insulin, and they end up with insulin fatigue, or they can end up with insulin fatigue and type 2 diabetes. Um, so it's probably more dangerous for the baby than the mother. Um, Pregnancy-induced hypertension, which is called PIH, really starts out as high blood pressure, and it comes about because of the restrictions pushing blood through the placenta, and so you need more blood pressure to overcome that resistance. So it's simply hypertension, and it may be silent at that, like there may not be any symptoms. It can go into something called preeclampsia, which I'll talk about in more detail later, or eclampsia. Preeclampsia is really hypertension and proteins in the urine, and it throws off the whole osmotic gradients in the blood and in the capillaries, and it leads to a real systemic edema. This used to be called toxemia of pregnancy, but now it's called preeclampsia. And then eclampsia is really seizures. It's almost like epilepsy and convulsions that go along with it. And it's dangerous. It's life-threatening. If it's going to happen, it's usually with the first pregnancy, and really they treat it with blood pressure meds and bed rest. That's the big thing. It's like, okay, you're not doing anything that can raise your blood pressure. You're going to stay in bed for the remaining 2 months of the pregnancy or whatever. And you'll hear of this a lot, that women have to start their maternity leave early because of PIH. I actually like this mnemonic, HELP, which it stands for hemolysis, which is blood cells breaking down, elevated liver enzymes, and low platelets. So there becomes clotting issues, and sometimes anemia goes with it. With this hemolysis, hemolytic anemia happens, and so that actually will drive the blood pressure higher. The liver enzymes come with the hemolysis and the extra iron that is stored. Another complication is ectopic pregnancy. That's on your list of things of pathologies that we're to look at, and it's really very simple. Ectopic pregnancy is when the fertilized egg with the ova implants someplace other than the lumen of the uterus. Most often it's in the fallopian tube, so they call them tubal pregnancy. But literally, the fertilized egg, because fertilization happens in the fallopian tubes, if the currents and the cilia aren't strong, the egg can fall back out and implant uh, on the ovary itself, on the surface of the ovary, or anywhere in the peritoneum. Uh, that's a very bad complication if that happens. Another place it can actually implant is right on the cervix, and uh, and lead to the placenta being in the way of delivery, uh, and it's a cause for cesarean section. Uh, it's called placenta praevi. The If the placenta is actually covering the cervix, then there's no way for the baby to get out without destroying the placenta, and there's not enough time to deliver, to go through labor with a lack of oxygen. So it can be a real bad complication. So pregnancy massage is really takes some special training, and I know you're all getting it. I know that you have pregnancy outreaches, and I know that you will learn a lot about this. But this is kind of Ruth Werner's take on it. It's so for uncomplicated pregnancies, you got to just go with caution, and it depends on the trimester. So in the first trimester, don't be poking around too much at the belly. You know, it. It's basically work pretty much as normal, but don't do any deep abdominal work. In the second trimester, now you're going to need support on the client. Lying prone is not advisable unless you have pregnancy pillows. At my clinic, all the massage therapists, we have a pregnancy pillow for each of the rooms, and what happens is it supports the client in ways without putting any pressure on the belly, or the boobs for that matter. And I swear that there's a lot of pregnant women late in the second trimester and the third trimester that come in just so that they can lay prone for a little bit. So yeah, you just will learn all about this, I'm sure, in your technique classes. Uh, these are a couple of websites that look at eclampsia and preeclampsia, PIH, and this one is gestational diabetes. Let me see if I can pull it up. I'll follow up with videos going to these websites.